genesis of this grant was work that we do in our endocrinology training program, where our fellows provide care to incarcerated individuals. We noted that close to half of those patients were transgender and required gender-affirming care, and recognized that in order to provide better care, not only did our fellows need to be educated in gender-affirming care, but also our colleagues and counterparts at the correctional institution's healthcare system. Almost half, somewhere between 40 to 50% of the patients we see in a given day in our corrections clinic are transgender individuals, and we identified that there were the greatest gaps and inconsistencies in care to those individuals who are in corrections when we compared them to other patients with endocrine disorders that we were seeing.
There were some statistics that I think really were the foundation, or one of the foundations, for Dr. Malek and I to move forward with thinking about creating this curriculum. One was that nearly a third of individuals who identify as transgender had a negative experience with their provider or the healthcare team when they came seeking care. And the other was that nearly a quarter of individuals also identified that they felt like they had to teach their provider about transgender competent care.
So we worked in conjunction with that correctional system to identify learning needs of their providers. And we also identified that we needed to be able to provide knowledge on gender-affirming care that was based on the time schedule of the provider. And so we created a series of online modules to try to both increase basic knowledge in gender-affirming care and then also detailed specifics on providing gender-affirming hormone therapy.
We used a theme of trust in each one of the modules because ultimately, if you cannot create a relationship with a patient where they feel like you have honored their question, honored their concern, and that you have a baseline knowledge to direct either their care or direct them to the care that they are asking for and or need, we invalidate their ability to receive equitable care.
We looked at the people who did the full course, so they're doing all 6 modules where they're learning about gender-affirming care. 75% of the people that engaged in that survey said they had 2 hours or less of transgender teaching over the course of their training. And then when we looked at post-survey information, which were of course lower numbers, the vast majority strongly agreed that as a result of this training program, they increased their knowledge and skills in subject matter. So, our goal was to increase the number of providers out there who have foundational knowledge in transgender care, so we can say that we did that. On a personal level, I can tell you that this was a curriculum shared with employees of the University of Maryland Center for Diabetes and Endocrinology, and I had multiple members of our medical staff, support staff, so medical assistants who came up to me who had expressed a lot of discomfort or lack of knowledge in this area and how much they felt they had learned as a result of it. And so I know that the patients they interact with will have a different experience as a result of that. And that's what we did this for.